Okay, please continue.
All right, so hold on really quick. All right, sorry, we were having a bunch of echoing that we're trying to resolve.
If I don't charge the full violation, you're going to have to do the new case no matter what.
All right, hopefully, nope, that's not better. Hold on real quick.
Rocking chair in here? That rocking chair. Stand like that one. Could be. But I'm using it, so I'm on a meeting. I'll bring it down.
All right, we're gonna try that. Does that, I think we got rid of the echo. Yes, sounds better? Okay, good. Okay. All right, so we are gonna call the meeting to order at 1:07. And I will go ahead and ask Lily to do the roll call.
Commissioner Allman,
Present.
Commissioner Antle,
Present.
Commissioner Barish,
Here.
Commissioner Ebium,
Here.
Commissioner Riley,
Here.
Commissioner Muschetti,
Present.
and then Commissioner Rich and Commissioner Chandler are absent by prior arrangement. They let us know they were not going to be able to be there. And then Chair Miller.
Here. All right, do we have, we're going to invite public expression. Do we have any public on that would like to give any comments or provide any comments?
No, it doesn't look like it.
All right, then we will move on to the minutes. We actually have to start with discussion of possible action regarding the expenditure report on Measure B. Nope, sorry. I have 3 meetings in front of me. Sorry about that. Discussion of possible action regarding the resolution authorizing remote mental health treatment act citizens oversight committee meetings. This is the requirement that we have to vote in every 30 days to allow us to do remote meetings. Without this, we're not able to do a remote meeting. And so since it's been 30 days, we have to vote this in to do the remote meeting today. And it would also not cover the next time, but it is needed for us to move forward today with a remote meeting. Do we have any discussion? Yes.
Does this
Commissioner Riley?
mean, since we're only meeting quarterly, does this mean that our next meeting will be in person or that we will be remiss in passing the resolution?
So yes, we would not have passed the resolution for that meeting because it has to be done every 30 days. There is a conversation later in the agenda about whether we'll continue with remote meetings or go back into in person.
Okay, thank you.
Any other commissioner comments or questions? Any public comments?
No.
Okay. Thank you. Can I invite a motion?
I move we resolve to meet remotely.
I will second.
Any committee member comments? No?
Well, it's Almond. I'm curious, if this didn't pass, we wouldn't have a meeting today, I take it?
Yes, that's true. All right, Lily, do you want to do the roll call?
Yes. Commissioner Almond,
Yes.
Commissioner Antle,
Yes.
Commissioner Barish,
Yes.
Commissioner Ebion,
Yes.
Commissioner Riley,
Yes.
Commissioner Moschetti,
Yes.
and Chair Miller.
Yes. Right, so the next item on our agenda is discussion and possible action regarding the nomination and appointment of a vice chair for the Mental Health Treatment Act Citizens Oversight Committee. Does anybody have recommendations?
Chair, excuse me, I understand that Michelle Rich, I know she's not here, but I understand that she is interested in the vice chair spot, and I would like to put her name forward if that's okay with the rest of the commission.
I couldn't hear what name you said.
You gotta turn me up a little bit. Can you hear me now?
Yes.
I understand that Commissioner Rich would step up to the position, and I would like to offer up her name as vice chair if the rest of the commission concurs.
So this is Darcy. Chair Miller, could somebody fill us in a little bit of Rich's background, please?
Sure, I will probably not have all of Commissioner Rich's background, but Commissioner Rich has served on the Behavioral Health Advisory Board for 3 or 4 years. I know that she also does some other involvement in the community. I really can't speak much about her. I wish she was here today to be able to do that. Besides that, she has been involved in the Behavioral Health Advisory Board. I know that committee she has chaired and vice chaired, and I know that has actually not wanted her to leave the chair position because they've really felt she's done a great job. So that's what I can speak of regarding behavioral health. Do we have any other commissioner comments?
Is that right?
Commissioner Allman, we missed what you said. Any other committee comments, recommendations? Any public?
I'm sorry, Chair, this is Alman. Could you hear what I said? This is Alman.
No, Tom, we couldn't hear you.
So I'm a little confused. She's not here and she's not on the line, and she's been nominated to eventually become chair of this committee, and we're going to vote for her. Is that right?
That is the recommendation that Commissioner Muschetti put
I will vote
forward.
no. I will absolutely vote no until she can attend a meeting and she can advise us all that this is what she wants. We can continue without a vice chair till the next meeting. This is silly to vote for someone who's not even here.
I'm fine with that, Commissioner Allman. I think that's a prudent thing.
Thank you. Let's move on. But we have a motion and a second, though. We need the person who made the motion to either carry the motion through or agree.
I know we had a first. Did we have a second? Did someone second that recommendation? I don't think so. All right. So are we good with tabling this item till next meeting? Yes. Okay. Any public comment, Lily, before we move on?
No.
Thank you. Next item is the approval of the minutes from the December 15th, 2021 meeting. Any commissioner comments, changes to those minutes? All right, hearing none. Lily, do we have any public comments?
No public comments.
All right, do we have a motion to approve the minutes?
I move we approve the minutes. I move we approve the minutes.
I'll second.
All right, so we have a first and a second. Lily, will you do a roll call on that?
Commissioner Allman? Commissioner Allman? I'll come back to him at the end. Commissioner Ansel?
Well, I've read the minutes and I reviewed part of the prior meeting, so I will approve unless I need to abstain, and I'll look to chair for that.
You can approve, Darcy.
Commissioner Barish?
Yes.
Commissioner Evian?
Yes.
Commissioner Riley?
Yes.
Commissioner Muschetti?
Yes.
And then Commissioner Allman?
Yes, if you can hear me, yes.
Yes, thank you. And then Chair Miller?
Yes. All right, the next item on our agenda is the March 2022 Measure B financial report. And I believe that we have Andy Turchin to give us an update on that report. Andy, are you in the meeting?
Yeah, can you hear me?
Yes, we can right now.
Sorry, a thing popped up and I don't know what it was. So, good afternoon. Let me see. So, in your agenda, there is the March budget or expenditure report stuff that we did for through the beginning of March. I did notice there's some numbers on here that I'm not sure where they came from on the summary sheet. So just ignore those. I'm not sure why those are there. They're underneath the revenues. So, and I didn't, let's see. We have all the payroll up to date through pay period 4. So that's all included in the bottom of your sheet on the second page, I believe, third page. And I believe most of the behavioral health training center expenses have come through. So there might be one or two small things, but I believe I was told that most of the behavioral health training center expenses should be pretty much done that I know of. I don't know if anybody had any questions.
Any commissioners have questions on the report?
No questions at this time.
All right. Lily, do we have any public comment?
No.
All right. Do we want to make a motion to accept the fiscal report as presented?
I'll make the motion.
But this is Almond. This is a financial report. What is the motion? I mean, the financial report is just presented to us to let us know what's going on. I don't think there needs to be a motion, a second, or a vote on approving or accepting it. It's information.
And we can do it that way, Commissioner Allman. I know that at some meetings, Brown Act meetings, we do in our world, we at least accept the report so that we accept that we've seen it and accept the expenditures within it.
So we're going, and I don't mean to be a naysayer. We're going to accept the report that when it was presented said there's numbers on there that she doesn't know why they're on there. We should ignore them. I want to make sure I'm understanding this.
The numbers
I
were
support Measure B, but what we shouldn't have mistakes like this. If the report has a mistake on it, then we can bring it back and approve it when there's not a mistake.
Andy, what were you going to say regarding?
I was just going to say the numbers don't mean, they were just numbers. They don't have attached to any of the totals.
Well, by all means, let's by all means then, I will not stop it. Let's have the motion and the second and let's vote on it.
So we have a motion on the floor to accept the report. Do we have a second?
I'll second.
All right. Do we have any other additional comment from the commissioners? All right, Lily, can you just do a roll to accept the report?
Yes. Commissioner Allman? Commissioner Allman? Commissioner Antle?
Agree, approve.
Commissioner Barish?
Yes.
Commissioner Ebium?
Yes.
Commissioner Riley?
Yes.
Commissioner Muschetti?
Yes.
And I'll go back to Commissioner Allman. I don't know if you can't hear us. And Chair Miller?
Yes. All right. Lily, it sounds like Commissioner Allman was voting no.
That is correct. Almond voted no.
Okay.
All right. Unfortunately, Tom, you're not coming in, so we can't always hear you. So that's there's seems to be something where we're not always getting what you're saying. All right, so we will move on to the next item, discussion of possible action regarding the fiscal year 22-23 Measure B budget. We've been asked to please bring the budget forward in draft before we submit it to the county for final approval. And so we wanted to go ahead and make sure you guys had the budget in front of you today to look at, give feedback on, provide any comments you have. And so Andrea is also going to walk us through the proposed budget for Measure B for 22-23.
Okay, so the proposed budget, I think everybody has a copy of. On the top of the salary and employee benefits, I know we don't have a project manager right now, and we weren't, I don't know what the plan, we didn't know what the plan is at the time to hire one or not, but we wanted to make sure we had budget authority on that line item, just in case somewhere down the line. I think right now the plan wasn't to hire a project manager, but we wanted to make sure we had some budget authority in there just in case some things have changed. So we just budgeted half of what the project manager salary and benefits are. If we don't use it, we don't need it, but just to make sure that it was, our authority was there. The communications, the next section is the services and supplies for Measure B. So we put communications, insurance, the general insurance, which is an estimate right now, some office expenses. We have a contract, the 4 contracts there on the left-hand side that are right now estimated to have for next year. Some office expenses, our 887 costs that the county charges. And I try to break it all up to where you could see where the total amount is. So we have some information tech costs. The county is charging us enterprise cost, which will go in there for their, I believe, the upgrade for their system, the county system, and some the Zoom costs. And then I added a little bit of IT costs because not sure if the role need any, for the Behavioral Health Training Center, there might be some IT costs in there. The special department expenses where our salary and benefits get transferred. So like my time or Fiscal's time, the MOPS team, that's where their salary and benefits will come in. At the time of this, doing this report, we had not had our salary and benefits estimate projections from the, so that was just a guesstimate on what we have at the time. We'll get more permanent projections with when we receive the auditor's projections for salary and benefits. Let's see here. Then for our construction costs, we put the CRT, crisis residential. The generator is still pending to be put in. Not sure if it's going to be done this year or next year. I don't know. So we wanted to make sure we have the authority when it does come in. If it's after the fiscal year, we at least have that. And then I got these numbers from facilities because they're the ones that keep track or know what's more going on with that. And then for the PUF cost, we did for the design and construction and to start demolishing the building. And then we put in some of the lease and then rental fees for the Behavioral Health Training Center if when those get rented out. So I'm not sure. Any other questions people have?
Commissioner Riley?
I have a couple of questions. You mentioned that there's a project manager in there, and maybe my memory is incorrect, but I thought that position was eliminated. Could somebody clarify if that's what happened?
Yeah, the position was never eliminated. It was always within the budget. The position number still exists. The position still exists. When we budgeted this year, we budgeted at 50%. One was the original, when the committee voted to add the position, it was a 5-year position to coincide with the 5 years of the capital facility funds. And so we didn't know whether the 5-year ends in April. But the position is still there. It is vacant. And so we did put funds in to at least, if we were to fund it, we would be able to fund it. And we can always go at mid-year or first quarter or third quarter and increase that if we do end up hiring a project manager, but the position does exist.
Okay, I guess I'm curious about what that would look like, given the fact that this board did not terminate the last employee. This board was not a part of that. So would the Measure B committee be involved in the decision to restart that position and hire it, or would that be completely up to county staff?
No, if there was if we move forward with hire, yes, it would be a committee decision to whether or not we would move forward with hiring a position.
Okay. And then my other question is regarding some of the projects. And so there are specific projects outlined here, the CRT and the PUF. If a project is not listed in this budget, does that mean it does not have a pathway forward in the next fiscal year? And where I'm going with that is I'm increasingly concerned about our lack of attention to substance abuse treatment with Measure B funds. It was outlined as a significant priority throughout the Kemper report, and we have not allocated any money for it. And I'm concerned if it doesn't show up in this next year's budget, that there may not be a pathway forward for it in spite of its prioritization.
So if an item what is in the budget are items that the committee has approved. That doesn't mean that we can't amend the budget at mid-year, first quarter, third quarter, if another project is approved. But the projects within the budget are those that have been approved by this committee to date. So this budget really looks at which projects have we approved, and this budget is built on the projects we have approved to date. But if we were to, as a committee, decide to put money towards substance use, we would then have to amend the budget to add those funds in for this year.
Okay, thank you.
Commissioner Allman, I know you, did you have something you wanted to add?
Well, it's exactly that. And I agree wholeheartedly with Commissioner Riley that we were not involved in the termination of the project manager, and some of us thought she was doing a stellar job. And I certainly want us to be involved in approving, I'm not talking the personnel decisions. That's not it at all, because I understand that there's a reason we can't do that. But this is if Measure B is going to be paying for this, I certainly want Measure B committee to be a little bit more involved in some decisions that in the past were made without our knowledge. Thank you, Commissioner Riley, for saying that.
Commissioner Ebian.
I just have one question about the budget for professional and special services, the $860,000 budgeted amount. And it says contracts next to it as a note. Which contracts are in there?
If you look over on to the right where it says account 8621889.
Oh, it's right there.
Yeah,
okay.
So they're listed out.
Okay, great. So I guess here's my underlying question. Oh, community ed awareness. Okay. Never mind. I'm good.
Okay. I try to put in the parentheses, I try to put what the provider or the contract is, because I know community education awareness was like a program or so NAMI is the one that has that contract.
Yeah, that's great, Andy. Thank you.
Yeah.
Any other commissioner comments or questions? Lily, any public comments?
Yes, we have John Haschak.
Supervisor Haschak?
Hi, good afternoon, everybody. I had a couple questions about the budget. One was the A87 cost listed as $20,000. And what are those charges for, actually? Because it seems like we're doing most of the stuff in-house. So I thought, is there a breakdown of that 20,000?
The 887 cost is what the county charges us for some of their charges. So like this year, our 887 for 21, 22, let me pull it up real quick, was close to, let me pull it up real quick. Yes, there is a breakdown. I just don't know it off the top of my head. So they charge for the executive office, auditor, controllers, some human resources, facilities, information services, and anything that like retirement. So part of the county's cost that they charge, and I'm not quite sure how 887 is, but I believe, and Janine, you might not have a little bit more idea, is they deduct it from their actual cost, and it goes back 2 years. So the totals they get actual cost 2 years back for what the county charged, and they split it out between departments.
Okay, thank you. Another line item, it says lease CRT. And so is there a plan to lease out the CRT?
No, that's revenue that the CRT is going to give us. So the provider, RCS, Redwood Community, pays the provider, or pays us or Measure B back for the lease.
Okay.
Yeah, and then the rental fees for the behavioral health training center.
And then is there, I see some money listed for maintenance of the CRT, but it doesn't seem like it's very much. Minor expenses. Do you think it's like $5,000? Do you think that's going to be sufficient for this new building as it gets used?
I don't know, since we've never really done that. I'm not sure how, I believe we're going to have a contract for cleaning, but I don't know what the county might charge to maintenance it yet.
Okay, so that's kind of an unknown.
It is kind of an unknown, but we'll get a better idea this year since we've never had it before. So it's hard to judge what, costs are going to actually be, but we put some in there just in case. And hopefully it's not as much.
Okay, thank you.
Can I ask another question?
Yes, go ahead.
Thanks. And this is following up on John's question about I guess they're called A87 expenses. So there are the people in the county who work, who spend time related to Measure B are included in the special department expenses. But that A87 are people beyond those that we see being paid through each of the pay periods. They're outside of the ones that we see listed.
Yeah, so 887 is a county expense to the department. So every county department pays 887. So behavioral health has an 887 that's separate, MHSA, SUDT. So it's for expenses like county council, IT, auditor's office. It's a different expense. It's not the expense of the staff that are providing. So 887 does not include any of the staff that are providing support to Measure B or doing the Measure B programs.
Right.
887 is all of more of the administrative programs for the county. So your IT, your HR, your county council, that kind of piece. It doesn't impact, it's not programmed. So we pay 887 cost in behavioral health also. So it's something that's charged. And it took 3 years. What Lloyd had told us that it would be about 3 years before we started seeing our 887 costs come forward. And so we did get our 887 costs are starting to appear. We are asking questions about the 887 costs just to make sure that we sort of align with that we agree with sort of some of the charges, but it's a specific percentage of the way they decide how to charge those.
Yeah. They're not direct. Well.
So I have two last things. One is the mobile crisis response that the Board of Supervisors has approved. I know the expenses for the mobile crisis responders is included in professional and special services. And so I'm wondering why that's included there as opposed to in the 860,000 group, because those are all special programs that the Board of Supervisors approved. And why it wouldn't be put into its own group like aftercare crisis or community awareness or crisis respite.
It's just a line item of where, so 862 and 89 is where our contracts go. And then since the mobile crisis is not technically it's not a contract, we don't contract it out. It goes in the 2239 for staff charges of special department expense.
Okay.
So that's why it goes in there, because they're more in-house transfers versus a direct payment to a contractor.
Okay. And my last question is the CRT. Forgive me if I don't see it here, but because I don't see any specific expense other than a small amount, where did I see it? The 56,000. Oh, here.
248.
To projects. Does that mean that the cost to operate the CRT is going to be fully reimbursed?
So yeah, the reason we did the original lease for the CRT at $1 was so that they would be able to charge a daily rate that allowed for us to be able to use realignment dollars and Medi-Cal match to be able to cover the cost of that facility. So the hope is that we will some of the realignment dollars that goes into hospitalization costs will be redirected to the CRT, because we will have an option, and psychiatric hospitalization isn't the only option. So we're hoping we put some MHSA dollars into it, in addition to hopefully some redirecting of the realignment from inpatient care, so that we're able to make up a 40%/60% Medi-Cal match. So we didn't have to ask Measure B to have to augment the cost for operating the program. So we will know by the end of this next fiscal year if that's a viable model. That was the model we put in place. That's why you're not seeing that, because we are really hopeful that the services will cover themselves.
Great. Wonderful. Thank you.
Commissioner Riley.
Thank you. Yeah, I would just like to thank county staff and Andrea in particular. I think this is the earliest we've ever seen the Measure B budget, and I think it's the only time we've ever had somebody available to answer all of the questions about it at that time. So thank you very much.
Yeah, the timing was pretty good about the meeting and getting it done.
Thank you.
Yeah. And it looks like County Counsel Curtis has a comment.
Thank you, Madam Chair. I just wanted to add one additional nuance with respect to the A87, which is that sometimes the cost of an individual department may be broken up in a way where some of it's captured by A87 and some of it's by direct billing. So, for example, my own department, we bill some of the departments for our hours, and that may be direct billing, but that would only be for the time of the attorney. So the additional costs like the office space, the lights, the supplies, those would end up getting captured from the A87. And additionally, the time that we might spend advising another department that is an A87 department would also end up getting lumped into the A87. So that wouldn't be reflected in a direct bill. So for example, if we're advising HR on a policy, the costs of HR, that time might end up getting essentially rolled into the A87 cost because HR is an A87 department, and then get divided among all of the various funds and departments pursuant to the A87 cost plan. So I know that's a little bit complicated, but I just want you to be aware that there's some nuances in there. We do try very much to make sure that there's no double billing, but it can get a little bit confusing. There are times I've had to refer back to the auditor's office to determine what should be in what bucket.
If I may, I think it may be a requirement that an allocation plan be published as part of the budget document. So I assume it's on the county's website somewhere. The city calls their version of A87 as the cost allocation plan. And as Council Curtis said, there's different ways. So maintenance is allocated according to square footage. HR charges are allocated according to number of employees that they serve. And so there should be some kind of a formula and explanation of that included with the county's budget, I'm assuming, on the website. I haven't looked.
Any other commissioner comments? Any other public comments?
No, it doesn't look like it.
Is there a motion to approve the budget so we can get it submitted?
This is Alman, and my motion is going to be a little different because I don't know what the plan is, but it would be to approve this. But are we going to get quarterly updates of where the money is going? I don't want to be surprised at the end of the year that we were under budget or way over budget.
Yes, you will be getting quarterly updates of the finances to the budget. So you should be getting that. And I know there's another item on here to talk about another possible financial plan, but we can talk about that when we get to it.
Yeah, and on the bottom, on the bottom of the financial reports, I put the summary of what the approved budget amount is and what our year to date, and then whatever's remaining. So we can update that as adjustments are being made to the budget amounts if needed.
So Alman will make the motion. We approve this as submitted with the understanding that we'll have quarterly updates of the budget.
Can I make an addition to that at this point, or do I have to wait?
You mean to Tom's motion?
Yes. I just wanted to request that we get monthly, even though we're not meeting, that we can still get a monthly report.
Sherry, you will still get those, just like we sent out in January and February, the monthly reports. We're not stopping that. Those are still happening.
Okay, wonderful.
Yes.
Great.
Do we have a second?
I second it.
Any committee comment? All right, Lily, can you do a roll call vote?
Yes. Commissioner Alman,
Aye.
Commissioner Ansel,
Yes.
Commissioner Barish,
Yes.
Commissioner Ebiom,
Yes.
Commissioner Riley,
Yes.
Commissioner Muschetti,
Yes.
and Chair Miller.
Yes. Right, the next item on the agenda is an update and discussion regarding Measure B related items at the Board of Supervisors meetings. Since our last meeting, we had 2 items that went to the board. And one of them was the approval for the crisis intervention training that the Sheriff's Office did in November of 2021. That was approved by the supervisors to reimburse that expense for that CI crisis intervention training. The other was the psychiatric health facility. The board was presented with the feasibility study and asked to make a recommendation on whether to move forward with Whitmore Lane and which option to move forward with Whitmore Lane. The board did vote to move forward with Whitmore Lane as the site for the psychiatric health facility. They also voted to move forward with option 2, which was to demolish the existing building, reconstruct a new building, change the entrance of the facility so that you would be entering off of State Street instead of Whitmore Lane to reduce traffic and impact to the neighbors that are there on Whitmore Lane. And so that was the board's decision, and we are moving forward with that project. Those were the 2 items that went forward. Any questions on those? All right, any public comments, Lily?
No.
All right, I will move forward to the next item. The next item is an update and discussion regarding the status of the current Measure B projects. And we are doing a monthly report, both sending it out when we do or don't have meetings, along with the fiscal report. It's going out monthly. Just a quick update, the regional training center is operational, and we have been having meetings in there on a regular basis. There's been county departments using that facility a couple times a month for a variety of different trainings. We are looking to reschedule the grand opening of the training center. Right now, we're looking at April 26th. We will be confirming that date and get that out to you, but we are looking at April 26th as the grand opening for the training center. We just need to verify that there wasn't a training scheduled for that day, but we think it's a pretty good date. The community education awareness and support, NAMI has hired an executive director. They have been actively working for the last couple months with our Native community and created a Native community connections group. They've been meeting regularly with that community with that group. It has been very beneficial. There has been a lot that has come out of that group. And we have a lot of new projects, and NAMI has really been working with getting education out to them and working with that community on what is the best education resources and how can they support them in attending a variety of their different activities that the tribes are putting on. They are also working on a community training to focus on de-escalation. How do you deal with an individual who may be escalated, regardless if they're mentally ill or not, and you encounter them within the community. So it'll be a community training that'll be a joint NAMI and behavioral health training on just de-escalation tips for the general public in a situation when they need them. The crisis assessment and psychiatric aftercare has been serving clients readily. We've gotten a lot of feedback that it is nice to have this service available so that they can get connected. It's a service people with private insurance did not have prior. You can see that how many individuals they have served each quarter. So what we have, when we look at the numbers for July through September, they served 62 individuals. In October through December, they served 116 individuals. And that's a variety of services, from working on trying to get them into a crisis placement afterwards, doing additional crisis intake, crisis interventions in the field that are supporting them in the recovery afterwards, individual rehab, individual therapy, and continued risk assessments, working with individuals to make sure that they're connected and they're not needing a higher level of care. They also broke down the payer source of the individuals they served. You can see where the Medicare, the private insurance, VA, indigent, and did some services for those that are incarcerated and coming out. Crisis residential treatment. We are hopeful that we will hear any day that that they received the license. They were able to finally get CCL to come and do a walkthrough, which is the biggest part of the licensing process. Yesterday, the walkthrough happened. They found no issues with the site. They actually thought the site was very well done. And so we are hopeful that they had said it's possible within a week we could get licensing. We're continuing to work with Community Care Licensing and Department of Health Care Services. We have to have both of them sign off. to open the facility, but we are way closer than we have been, being that the walkthrough has been completed. So fingers crossed, any day now, we hope to see that facility open. The mobile crisis response teams, we have 2 full-time workers inland that are working 7 days a week. They are working with both UPD and the sheriff. They've been able to expand to be able to provide 7 days a week support to both Ukiah Police Department and the Sheriff's Office. It has been working well, and it has been a good collaboration, and they continue to go out on calls, and we have gone on several calls and a lot recently. The audit is proposed to be done March 31st, so we are hoping to get those results so we can get those out to you guys and definitely have those for our next meeting. As I said about the psychiatric health facility, the board approved it, where we are in the process of working on next phases of demolition and what the architect and the construction company needs to do for us to get there. And then we did also get approved the operation agreement with Redwood Community Services to operate the PUF. And as we noted prior, we are hoping that we will be able to operate that with realignment and Medi-Cal match funds so that we don't have to augment with any Measure B dollars. And then also the lease, which is we are leasing the facility for $1 in the hopes that that allows us to keep the rate low enough that we're able to get the reimbursement to cover those costs and not have to ask Measure B for any dollars to cover those costs. Do we have any comments, questions? Commissioner Riley.
Just a couple. I do want to report on behalf of the city of Ukiah that the mobile crisis team is much appreciated and has been very effective so far. So we're grateful for that partnership and look forward to expansion of those services throughout the county because it has already proved to be extremely beneficial. And then I also want to go back to the training facility for just a moment. And I was wondering if we could get a status update of the sheriff's substation that was intended to be located there.
I don't have a status update. Maybe Commissioner Allman can give us an update on the substation.
No, I believe that building and grounds would be the appropriate. So if we wanted to put on the budget or the agenda for next time, that might be appropriate.
Thank you. I would like to see that, given that the sheriff's department was supposed to split the costs of the facility. So now that the facility is starting to be used and whatnot, I'd like to understand if there's going to be a more significant impact to Measure B than we originally anticipated. So could I have that placed on the agenda for our next meeting, please?
Yes, we will. We will add it as an item if you can submit the agenda item when it comes out, but we'll note that it will be on the next meeting.
Thank you.
Any other commissioner comments or questions? All right. Any public comments?
No public comment.
All right, so we'll move on to our next item. And our next item is discussion and possible action regarding the proposal to update the fiscal plan monthly. Send it out to the Oversight Committee along with other county reports that are sent and use it as a budgetary tool in discussions and making recommendations. And I'm going to hand this over to Commissioner Ebion.
Thank you. So included with our agenda was an Excel spreadsheet, a 9-page, if you print it out, it's 9 pages. And I wanted to briefly go over how it's organized. So it would just to cut down your time in trying to figure out what it's about. But basically, the purpose of this is when as a member of the Oversight Committee, when I'm asked to make a recommendation that has financial implications, I may think it's a really good idea what's being recommended, but the flip side or the part that also is important to consider is what are the financial implications of making a decision. So that's what this is. That's what this financial plan, it's my hope that that will provide some information to not only the board, the oversight committee, but the board of supervisors, if they use it, when they have to make decisions or recommendations. They have a financial component to them. So this is broken down. I'm just going to give you the general overview. I'm not going to go into all the numbers because there's so many here. So the overview is the first 4 pages or so, 5 pages are 9 projects that have been either approved or considered, whether they some are in the Kemper report and the Measure B hasn't gone forward with only 2 out of those 9. 7 of them have already been completed. They're in the midst of and they're operating. So the first one is the Crisis Residential Treatment Center. And the way each of these 9 projects is set up is there's 2 budgeted columns. One is for capital costs and the other is for operational costs. And the reason it's broken down by that was because in the Measure B law or measure, there's a requirement that no more than 75% of Measure B monies are spent on capital costs, and a minimum of 25% is spent on operational costs. So while I'm not an expert in determining which are capital and costs and which are operational, based on some of the research I did, I tried to put the budgeted costs in there, one of those 2 appropriate columns. The next column are actual expenses, and those are derived from the county reports. The first 3 years of reports that we received, they came mainly from Lloyd Weir, and they were in a completely different format than we have received in the last number of years. The last 3 years, we have received reports from the financial software of the county. And so it comes out, it's called BU, Budget Unit 4052. And that's what Andy Turchin presented to us. That's the budget as it would appear in the county budget and as it's printed out from that financial software. But we didn't get those until after 3 years had gone by of 3 years of meetings. We did get financial reports. They were just in a different format. So that's where those actual expenses come. That's the third column. Then the balance between the budgeted cost and the actual expenses. Next column, notes and questions, just something for clarification. Then the next column is annual ongoing costs after expected reimbursements. And I already see one thing to change on that from our discussion today, which is right here at the bottom of page 1, the CRT. I had an amount of $500,000. That was a number that was thrown out much earlier in the Measure B meetings. And listening today, what I heard is that hopefully between the 40% county contribution and the 60% from Medicare, there won't be any Measure B cost. So that could be revised to 0. It could also stay at 500,000, just depending on what's recommended. And you can see that there's a $2 million budgeted cost right at the end in the second budgeted column, operations. All of these budgets are for 4 years of costs. So that $2 million was based on $500,000 per year for 4 years. After that, it would become an annual ongoing cost. So that's specific to the crisis residential treatment set facility. The second one, the PUF unit, those numbers come directly from the Board of Supervisors approval based on the Nocton Lewis AECom LACO study. The third one, the Crisis Stabilization Unit, this committee hasn't brought that up yet, but I've left it in there. It's in the Kemper report. There's certainly discussion to be had, I would think, about that. But anyway, I'll just leave it at that. The fourth one is the Behavioral Health Regional Training Center. And part of the costs at the bottom there are for possible salaries, custodial, building maintenance, mechanic, landscape maintenance, possible other. And those are budgeted for 4 years. And then there's the annual ongoing cost would be the cost per year. The last column I didn't mention, contingencies. When I first started putting this together, there were a lot of contingencies that were part of contracts, part of discussion. And so rather than keep them in the actual budget, I've pushed them out to the side, just so we have a kind of as a reminder that they're possible. Then we go to projects 5 through 9. 4 out of 5 of those have been approved. The mobile outreach, community awareness with the contract with NAMI, the Coast Crisis Respite, and the other one that's been approved is Aftercare, a contract for that. The only other one that is still on, that has been part of the Kemper report, was supportive housing. And that hasn't been discussed, or I don't have any further information on that other than what it would cost. That was listed in months ago in an earlier meeting. So those are the 9 main projects. After that, I wanted to capture the expenses for services that are not related to the projects. So our report started in 2017-18, the very first expense being to actually run the election, the Measure B election. We had the Kemper report. Then we've had consulting expenses, some county salaries that were not broken out in the way that they are now using the county financial software, some office related. These were all just given to us on a line item and then tallied up. So for 17-18, 18-19, and 19-20, that's how the Measure B Oversight Committee received that financial information. Beginning in 2021, that's when the financial reporting shifted to the county financial software using what I mentioned as budget BU 4052. So we have the actuals for last year. We have the budgeted amount for this year. And I had put in a projected 22-23, which basically mirrored this one before I ever saw the one that we received today. So that would certainly be something to adjust. So after all of that, at the bottom of, I think it's page 7, are the total Measure B dollars that are allocated, budgeted only, just budgeted, not spent. So you can see and this is only in this budget. And that's, when I say this budget, this is going forward as well. So you can see there's a little over $42 million that have been budgeted. One thing I wanted that I skipped over that's important to mention is that the ongoing costs when I look at the budget for that, the ongoing budgeted costs, that was column 1, 2, 3, 4, 5, I believe column 6, is a little over $2 million. About 25% of that was that $500,000 for the CRT, however. So that's a number I just want you to hold on in your head for a moment. That $2 million of ongoing costs.
Annual?
What's that?
Is that annual? Thank you.
Yes, annual ongoing costs. And there, I put a note there. It says when the tax rate is lowered to 1/8%. Currently, it's 0.5%, which expires next March, a year from this month. When it's lowered to 1/8%, 1/8 is 1/4 of 1/2. So if we get somewhere between $8 and $8.5 million of sales tax revenue, 1/4 of that would be a bit over $2 million. So you can see these annual ongoing costs, which are a bit over $2 million, even within that $500,000 CRT number in there, they would support the current annual costs that this plan shows, and that the committee and the Board of Supervisors have put in place up to this point. I didn't have a real solid number for annual ongoing costs for the PUF. That's still in the making. So if we keep going, we had the allocated costs just over 42 million. I'm going to the next page where it talks about revenues. The actual revenues are for the first the first year, 17, 18. There was only 3 months of actual revenues for that year. Then the next 3 full years, the current year, and then a projected year for next year, but it's only 9 months. So it's basically 3/4 of what we might expect in a full year. So, and then below that is revenue from quarterly interest. And if you look on the far right, the projected total revenue is around 44.5 million. So compare that number, 44.4 million, with the allocated of 42.2 million. There's about $2.25 million unallocated. And that doesn't mean that's everything that's been budgeted will actually be spent, or it may be overspent. But that's the general picture when I look at the information that I've been privy to. The last page, I wanted to try to make sure that the expenses that are in the actual expenses that are on this financial plan match the county's actual expenses that we've received every month. Those 3 years from Lloyd Weir, the 3 years from the county financial, and up to the current month. And you can see I'm not going to go through all this in detail unless you have a question, but it's really almost to the penny. So I felt pretty confident about how the county expenses are shown in this financial plan. So it's my hope that this can become part of our regular reporting, so the committee can see where Measure B is from a financial place. What kind of financial footing are we on at this point? So I think that's enough out of me.
Thanks for all your work, Sharon.
Do you have any committee comment or questions? Commissioner Riley?
Yeah, Sherry, I really want to thank you. This could not have been an easy spreadsheet to put together, but it helps paint a really clear picture of what the committee's done and where it's going. And I really, really respect your talent and appreciate your time. So thank you for this.
You're welcome.
And then I have a question, I guess, for maybe Andy. Thank you for clarifying, Sherry, when the 0.5% ended. Is the reduction in revenue factored into the 22-23 budget that we saw earlier today, that reduced revenue for the final 3 months?
No, I believe the number was 8 million, which is more of what we might expect for a full year. And the number I had used in this report for the 9 months for next year was 6.375.
Yeah.
Yes.
Yeah.
Yeah. So I basically took 3/4 of, I think, 8.5 million, because you can see the prior 3 years. I mean, 2021, we were over 10 million, 1920, 8.6 million, and then 8.5 million. So I used a conservative number of 8.5.
Okay.
It's always my belief that you want to overestimate expenses and underestimate revenues.
Under promise,
To be
over
on the
deliver.
safe side.
I get it. Yeah. Well, I guess I just a note to county staff that change at the 9-month point should definitely be factored into next year's budget, even though we did just vote to approve it. So that's it. And then I'm just going to say it one more time. If this spreadsheet is accurate, there's some money on the table and a major gap in services that we have not touched yet, which is substance abuse treatment.
I'm sorry, can you hear me? I'm having some sound problems on my end. Sherry, do you have the prudent reserve in there?
No, I don't.
Okay, I just want to make sure, because we did do a 6 something. I'm sorry, I can't remember.
Right, and I think.
Just wanted to make sure. Thank you.
Okay.
Any other commissioner comments or questions? Commissioner Riley.
Sorry, I'll just say one more time. I'm somewhat shocked at how far over budget some of these projects have already gone. And so I hope that we're continuing to make every effort to keep the future projects in line with what our projections are.
Any other commissioner comments? I would just add that, Shannon, we did work with the auditor to when the revenue is going to decrease and take that into account for the budget. So that was a conversation we met with the auditor's office specifically to make sure we had an exact date when they think the switch will take effect. The PUF is estimated to cost us $1.8 to $2 million a year. So that should be in there, because I know there's not a dollar amount in there right now, but it is projected to possibly cost Measure B and operating cost $1.8 to $2 million.
Dr. Miller, what did that number represent? The 1.8 to 2 million?
That's what Measure B will have to supplement the PUF to operate.
Oh, the PUF, just the PUF?
Just the PUF.
And the county currently, though, pays about 2 million.
We pay about it's about 1.4 to 1.5, but that's actually when we ran our numbers of when we worked with Telecare to ground their numbers and building a super PUF, and we looked at what we pay in versus what it will cost to operate, there's about a $1.8 to $2 million deficit that the county behavioral health would not cover because it's not currently our cost to cover, and it's not something we currently cover. So we know that it's going to, which is why we work so hard to get the CRT to be sufficient on its own, was because we know the PUF, if the telecare's numbers are correct, there's about a $1.8 to $2 million that we're going to have to make up.
So, and again, I already asked this, but just I want to be clear, that's above what the county currently spends to send people out of county.
That's correct.
Yes?
Correct.
And last thing, I haven't seen a copy of the Telecor contract. I know there was talk about possibly selling 4 beds out of the 16 to Lake County that they would pay for those 4 beds, whether they used them or not, they'd have access to them. And that was a way to greatly reduce that $1.8 to $2 million cost.
That is a way to reduce costs, right? It is a way is that some facilities will sell beds. So to reduce your cost, the other counties have to be willing to pay for the beds and pay it on a bed day rate, regardless of whether they're used. It does mean that Mendocino County has to be comfortable with giving up 4 beds, meaning they probably would not, we would have to be aware that we were giving up 4 beds, and if Lake County needed them, we could not use them. And know that it could, I'm just going to say it could, doesn't mean it will, mean that we would still have to send people out of county in certain circumstances. So adults. So, I mean, that is something that can be factored in. And then we have to see, are they willing to contract? What does that do to our overall cost? And as a county, is that where are we willing to make that, knowing that it could mean that we still have to send people out of county? So that it's a possibility. It is a financial strategy that can be used. But it's something we have to make sure we've looked at all angles and that the county as a whole agrees with that, because it could impact our constituents, right? Our residents would have to be sent out of county. So that's something we have to consider. But if we are estimating what our operating costs today, we do need to plan that what Telecare's numbers are at are about 1.8 to 2 million that we're going to have to supplement. And so,
do you have, I'm not trying to put you on the spot, but do you have a rough idea of how many clients are in out of county PUF facilities on average per day? Do you have that?
I don't have it off the top of my head. I'd have to run the numbers. I think we average on a given day, and it changes. Every year is different, right? So, we saw a change with COVID. So we may not want to use our COVID numbers to really say this is where we're at. We used to be about 11 bed days a day. We'd have 11 people in. If you really just looked at bed days, not people, right? So it's 11 beds a day on average a year was kind of where we were running a couple of years ago. And we'd have to pull our numbers today to really look at that. I try to look at it about once a year to see how many beds we need. We used to be about 16 and we did bring it down to about 11. But that doesn't mean that you don't have more than 11 people in at one time. That's an average across the year, right? So there are times you need 16, 17, 18 in one day. You can have people in a variety of different locations. So it's just an estimate and it's an average. Last time I ran it was about 11. I don't want to include COVID because that changed our whole world. And so I'd have to pull the numbers and look at for this year, as of coming out of COVID, how many bed days are we using? We know that people are experiencing more mental health than they ever have since the pandemic. And so we could project over the next couple of years to see an increase in possibly people needing services such as they need services, but needing that higher level of care services. So those are things to project into our numbers. I also didn't see an operating cost for the CSU. And so we would want to put that in there. I know at one point, Sonoma County was $12 million over their budget for their CSU. CSUs usually cost counties. They're not cost effective by the way you bill. So if we left this in here, it's a conversation we need to have. And I know Commissioner Riley brought it up, and it is a conversation that I have had with community that substance use has not been part of our conversation, and there is a need for more detox and residential treatment in our community. I know just sometimes trying to get people in locally, it can take a week or two, and people don't always want to go out of county. So we do have to look at, is a CSU our best move, or do we really need to be looking at substance use and building out our continuum here so we can keep our residents in county for that service also? And we also know it's a big issue in Mendocino County. We have high overdose rates, and it's something that needs to be addressed. So I'm just throwing that out there. But.
So last thing I wanted to mention is that when you talk about these 16 beds for the PUF unit, I mean, a contract is only for a given period of time. So it's conceivable that the county could go one way or the other, where they don't sell 4 beds and see how the numbers fall out, or they do sell 4 beds and see how the numbers fall out.
Yeah, it's a strategy. It's a financial strategy for some facilities. Sonoma County, built a psychiatric health facility. They estimated how many beds they need, probably less than they actually need, but they also did contract some beds to Marin County. And I think they also have Aurora, right, in their community. So they have a provider that can take Medicare and private insurance with no issues. And this added the Medi-Cal piece they didn't have within their county. In our county, we have nothing. We don't have an option for private insurance, Medicare, VA, or Medi-Cal. And so our hope is that our one facility will be able to serve all of those. So that might be a different way that we need to look at it, because we don't have that nice option of having another facility within our community. But yes, there are lots of strategies that are out there when counties bring facilities in to reduce their budget impacts.
Thank you.
Yeah. Any other commissioner comments? Lily, I think we have a public comment.
Yes, Supervisor Hasbrook.
Thank you. I'd just like to thank Sherry for this workup of this financial plan in a way. And, I've been working with her on it for several years, and she's very persistent in trying to get the numbers right. And what she does is take the numbers that are provided by the county in working this up. And so these are numbers that we can pretty much rely on. And I think it's really a great springboard for these conversations that we're having right now, because with this kind of framework, we can see, that, hey, maybe we do have a couple million to work with at this moment in time, but like we've seen with all kinds of construction projects, that the 19.5 million for the PUF might be 26 million next year. So we've got to really be careful of that. I had a question for Dr. Miller, is with talking about the super PUF, do you have a cost difference between a regular PUF and a super PUF, and what the ongoing cost would be for the county?
Yeah, so there is a different operating cost. It's more to operate a super PUF than it is a non-super PUF. If I remembered, it was about $750,000 approximately more to operate a super PUF, give or take. It depends on, they have to have a little bit of different staffing level and requirements. But if we don't do a super PUF, then you can't take Medicare. And most likely, and it's hard to know that private insurance will want to bill out of that facility because it's not at that higher level. So it's a question, if we're going to construct it to be able to make it a super PUF, how we operate it, we'll have to decide, do we operate it as a super PUF or do we operate it as a regular PUF? That changes a lot of insurance, how we can bill. And so that will be a big question. If we don't do a super PUF, Medicare clients will have to go out of county to get services if they need inpatient level of care, and possibly private insurance clients also. So then it really becomes mainly an indigent and Medi-Cal only facility. And so that could definitely impact who we serve in that facility. And I know the big goal was to really have a facility that can serve all the residents of Mendocino County, regardless of their insurance type.
Well, thank you on that. And one further question going on with the issue of beds. If we say had 12 beds and rented or leased out 4 beds to Lake County, for example, but we're actually only using on a certain day 2 beds, could we rent out those beds to anyone else in the meantime?
Yeah. So what happens, what generally happens is your counties that are around you know that once you open a facility, they know you have a facility. And what usually happens is, like we do, you start calling every facility that's the closest facility saying, do you have a bed? And if you do have a bed, do you have a male or female bed, right? Because that's what you need to know, right? Do they have a male bed or do they have a female bed? Do you have a bed? So the same thing would happen with Mendocino County. We would have a facility where Mendocino County residents would have the first right to the beds. But if we have a bed open and another county calls and says, hey, we have a male that needs a bed, do you have a bed? We could allow telecare to say, yes, we want you to take, if you have an open bed, we want you to fill it, even if it's with another county's residents. So I think that's a decision the Board of Supervisors will have to make as we move forward with the operating agreement of how do we want to operate that facility? Do we lease out, do we do bed days with Lake County? And then are we going to really want it to operate with its as much capacity? They always estimate a 75 to 100, to an 80% capacity, but it's best if they operate at 100% capacity. Are we going to then say, fill those beds regardless of which county has the client to put in that bed? And that's a conversation that will have to be had on how we want to really fill those capacities. Are they going to say that at all times 6 beds are Mendo and they can use the rest of the beds for Lake County and other other clients of other counties, or how are we going to create that operating model? And that will have to be a decision we make. But there's no, from the sense of Medi-Cal and the provider, there's nothing that prevents them from taking other county clients. They can take county clients, they can bill the Medi-Cal. That's not going to impede anything on their half. What it does do for Mendocino County is the conversation of, do we want to know that, meaning it could impact one of our clients going into a facility if our beds are full and we would have to go out of county. And I think the community concern that we would have to address, because we hear it quite often, is what if that person walks out from they're off their 5150 and doesn't want to leave Mendocino County? And there are agreements in places with some facilities that they have to pick up their residents. But if a resident from Lake County doesn't want to leave, sometimes there's nothing you can do, and then they would be within Mendocino County. So those are things community members have voice. So those are just, as we talk about our operation model, it's something we have to consider how the county community wants to see this facility ran.
All right, thank you.
Any other public comments?
No, it doesn't look like it.
Any other commissioners have any other comments or questions? Do we have a motion?
A motion for what?
Well, I think Sherry can ask you. I think her ask is that this become a standard reporting format for Measure B that's provided monthly. Sherry, if I'm wrong, please correct me, but I believe that is your ask.
Yes, it is.
May I ask for clarification?
Yeah.
Would the spreadsheet be maintained by county staff? Or is Sherry offering to continue to maintain this? How does the ongoing maintenance work?
I would assume county staff would need to take it over so that we could keep it up to date. Sherry did meet with my fiscal team to review this with them. So it would have to probably be absorbed by county staff so that we're able to get the most current data
and keep it up to date. I think that Sherry did offer nicely to volunteer her time, but I think it would, to get the most up-to-date info, I think the county behavioral health fiscal team would need to take that on.
Can I say something about that? When I met with the county staff, I had suggested, because they talked about taking this over, and that's great. And I had suggested that the numbers that are in this plan represent or correlate to the numbers that are received in the monthly reports or the report that the Oversight Committee gets, because sometimes there may be an expense that, for example, Nocton Lewis. When you look at Nocton Lewis, the actual expenses that show up in the Nocton Lewis page are a lot more than that have actually been recorded in the expenditures, in the expenditure reports that we receive for the month. And so for purposes of clarity, it would be good to have only the expenses that have actually been paid to be represented in this financial plan. And so that was the first thing. And then the second thing was, when I spoke with Andrea Turchin about this, that for at least a couple months, if I might work with her so that I get to see that the way she is viewing actual expenses and how they would be allocated in this plan are on this in the same way that I was looking at them when I began this project, just for a couple months.
Well, sure.
That's
sure.
all.
There's nothing that you from making a motion. I mean, I understand what you're saying, but you need to make the motion. I think you need to make the motion so we know exactly what you want. It sounds all good.
Okay. So, okay, then I'll make a motion that the committee use the presented financial plan as a budgetary tool, and that it is updated for each meeting in a way that matches the county's reports that are presented for each meeting, and that that the county staff work with me for at least until the next meeting, so we can feel confident that there's consistency in how this is thought about.
I second.
Any commissioner comment? Questions? All right, Lily, do you want to do a roll call?
Yes. Commissioner Allman?
Aye.
Commissioner Ansel?
Yes.
Commissioner Barish?
Yes.
Commissioner Ebiam?
Yes.
Commissioner Riley?
Yes.
Commissioner Muschetti?
Aye.
And Chair Miller?
Yes. All right, the next item on our agenda is the discussion of possible action regarding the future 2022 Mental Health Treatment Act Citizens Oversight Committee meetings. Whether we want to continue to hold them remotely, move to in-person, or potentially a hybrid model. And there may be questions regarding County Counsel Curtis on what we can do as a hybrid model, but he is here so he can hopefully answer those questions for us. But we are, as you know, we have been in remote model for the last couple years. There is a recommendation from some community stakeholders that they'd like to see Measure B back in person, and a reminder that we had agreed to go to Fort Bragg and never had a meeting in Fort Bragg. And so that has been some community feedback that we have received. And so I wanted to make sure
that was brought here and that we could talk about what we want to do. We have our meeting scheduled dates, but how do we want to hold these meetings going forward?
I'll just say I've had discussions like this at a number of meetings already. The logistics of hybrid meetings are pretty challenging. I know that the county is maybe ahead of some in mastering that, but we're 2 years into the pandemic and still having technical difficulties with just Zoom, let alone trying to do hybrid. So there's not a lot of locations that can accommodate a hybrid meeting either. So like, for example, the Ukiah Valley Conference Center is not able to accommodate that. So it limits the places where we can have meetings. And this committee has previously expressed an interest in meeting in our other communities. So my recommendation would be to either stay remote or to go fully in person, but that we don't attempt to do hybrid. Further, because this is a Brown acted committee, if we do hybrid and we have committee members chiming in from other locations, those locations have to be posted and open to the public. So that would be your personal residence if that's the case.
Other committee comments, questions?
I guess I would concur with Commissioner Riley in saying I think a hybrid is very challenging and it would be better to do one or the other, but not a hybrid.
Any public comment, Lily?
No.
I guess I'd like to know if there are any commissioners who are unable to meet in person.
I'm hearing none. Does someone want to make a motion on how we move forward?
I'm gonna make a motion that our next meeting's in a real person, in person.
I second.
And just to clarify that, do we want to make that just the next meeting, or do you want to say for the remainder of this year?
I'm gonna say for the next meeting, and then we'll figure out where this pandemic thing is going. I think it's gonna have to be a wait and see on everything.
Okay. All right, Tom, are we good at saying the next in-person would be in Ukiah?
I actually would like to do the next in-person at the training center.
Okay. Right, I'll verify that it's open for that date, that there's not a training scheduled, and then we can figure that out. We have a first motion and a second on the floor. Any comments? All right, Lily, do you want to do a roll call?
Yes. Commissioner Allman?
Aye.
Commissioner Ansel?
Yes.
Commissioner Barish?
Yes.
Commissioner Ebiam?
Yes,
Commissioner Riley?
Yes.
Commissioner Muscetti?
Sorry, yes.
And Chair Miller?
Yes. All right, so the last item on our agenda is the committee member report outs regarding items of general interest. I did want to note that in your packet is a letter from Commissioner Angelo, who, as most of you know, retired from Mendocino County on March 20th at midnight. And so we wanted to thank her for her time serving on Measure B, and we wanted to also, she wrote the letter, she wanted to make sure everyone got to see that. So Lily, do you want to go ahead and do the committee member report outs?
Commissioner Allman?
Nothing to report.
Commissioner Ansel?
Nothing to report, just I'm happy to join the committee and learn from you all moving forward.
Commissioner Barish?
Nothing to report, although just a question, Commissioner Riley. I would like to talk to you further about the drug problem in the county.
Commissioner Ebion,
Nothing to report.
Commissioner Riley,
Yeah, no formal report in terms of other activities, but yeah, the headline in the journal this last week was that there were more people in the hospital for overdoses than COVID. And it increasingly concerns me that we're not doing enough for prevention. We've built an 8-bed facility that costs nearly $900,000 per bed for 8 beds, and we're not addressing the substance abuse program, the fentanyl epidemic, the deaths that are occurring every day. So I will likely be bringing an item forward for the next meeting to discuss more money, more action towards prevention, whether that's a crisis stabilization unit, a substance abuse treatment, both. I want to support prevention in any way that we can, and that is a priority through the Kemper report. So I will continue to push for that. The Ford Street project is seeking funding opportunities for expansion. They are the only residential treatment facility for substance abuse in the county. So whether that looks like Measure B support or whether the county may be willing to use opioid settlement funds to help support these facilities, I'm supportive of that and want to discuss it further with this group. So thank you.
Commissioner Moschetti,
Nothing.
and Chair Miller.
Nothing. All right, so we will end the meeting at 2:45, and we will have the next meeting. We will plan to have that in person at the training center. If the training center is already booked for a training, we will come up with another location. I hope that will work for everybody. Hopefully it is not booked and we'll be able to have it at that location. And we will get it out, and we are shooting for April 26th as a reminder for the grand opening for the training center. So, all right. Thank you, guys.
Thank you.
Thank you.